Ella Whelan is up next, your first time, a newbie.
Yes, and I've picked an issue that's only relevant to two people on the panel. But here we go. So nobody seems to have picked up on this, but the Greens in their manifesto and their literature, policy literature, had a really quite astonishing argument. And I'm going to read this to you. They said that we will work to reduce the number of interventions in childbirth and change the culture of the NHS so that birth is seen as a normal and non-medical event. Now, that might just sound like, what's the problem with that? Lots of people have birth and lots of women have birth in different ways. But this is coming after months and years of news of the maternity scandal in NHS trusts up and down the country, where women and babies have been dying in horrendous numbers for reasons that should not have happened due to medical negligence. And whether it was the Donna Ockenden report or a recent report from the Telford Trust that said that normal birth was pursued at any cost by staff working in that NHS trust. This Green policy announcement arguing for less intervention, less help for women, and actually arguing that it was because things like caesareans were expensive is disgusting and just shows how little they understand about the actual serious issues facing women who are going through having kids, as I know at the moment, being pregnant again, are facing. And it was just quietly taken out. Nobody noticed anything. And I just wonder what people think about the fact that we talk about the NHS so much and austerity and money into the NHS. This seems to be blaming NHS lack of funding or lack of resources on women and suggesting that we shouldn't have help during childbirth because, what, it's too expensive? Renee?
Oh, look, I'm going to agree with you 100%. And as a doctor, obviously, I see women that have had the most horrific birth experiences at the hands of their local midwives and hospitals. I was left alone in a room to give birth, alone. My baby was born with no one in the room because they just didn't take me serious enough when I told them I was about to give birth. We have to listen to women, and things have changed then, and hopefully things are getting better. But this obsession that women are just acting up, but, you know, they need these interventions because they're too posh to push, or they're just not brave enough. It's just, this wouldn't happen if real men actually gave birth. It wouldn't. It's as simple as that. It's because it's women. And the Greens, what has happened to the Greens? Why don't they just care about the climate?
Well, I mean, that's an interesting... I know I'm asking three young men to try and put yourself in the shoes of a woman giving birth, but actually it's about more than that, which is that you have this sort of competition between resources, which everybody knows in the NHS are, you know, being fought over, let's put it that way, and the idea that patients should pay for it. So, I mean, Darren, even on a sort of global scale in the NHS, isn't this a bit shocking? It's a bit victim blaming.
Oh, it is shocking. It is totally shocking. And the fact that it's got so little coverage as well, and you've got middle-class people sort of applauding like demented seals, saying, I'm going to vote for this Green Party, without actually looking at the really horrible consequences that would be borne out for women, for example. There are other consequences. You know, there's a real entryism by some of the most extreme people, I would argue, in this country into the Green Party, shouting all sorts of Islamist chants and all the rest of it. And I think actually we need to talk about why they're doing this, and that to me is because the NHS model automatically requires rationing because there are finite resources within that model itself. I don't think any woman should have to go without and be put through immense pain, unimaginable pain and suffering, and actually the baby as well, in order to appease what... I don't really understand what they're trying to appease.
This is the crux. What Emma just said about patients being up against rationing, this is why we need, as a country, in the NHS, to have a conversation where we say, look, guys, this is how much money we've got. It's a lot. It's £180 billion. These are the services that we offer, because there's so much tut around the edges that we don't need, that isn't medical, and we need to say to people, what would you like us to do? Would you like babies to be safe? Would you like mothers to have the choice that they should have and keep their babies safe and forget doing varicose veins and whatever else?
But I think in a roundabout and wrong way, that, I think, is probably what the Green Party were trying to have a conversation about, but they just picked the wrong service to try and say, we're not going to do this anymore. I don't agree with the policy, but I do agree with the question that you just raised, which is, do we need to have a conversation about what the NHS does and what the NHS doesn't do? The NHS absolutely should be providing absolutely all the help that mothers need during childbirth, but there does need to be a question about what don't we provide, and every time someone says what don't we provide, there are going to be these kinds of discussions that go on.
I mean, the Green Party has said that they've removed this from their website, which is where it was found. Obviously, the manifestos will mainly come out this week. They say that they update it all the time and that they weren't sure it was there. I'm not quite sure how you accidentally come up with that policy.
Well, yeah. Sorry.
No, go on.
No, I think the thing that we have to also understand is that, and maybe it's because I'm thinking about this all the time, is that this isn't just a resources issue, it's also an ideological issue. I mean, I think the Green Party want women to go in a field and squat, basically. There's been an infection of sort of hippie mentality around childbirth. It's not just down to the Green Party, but is in midwifery in general. And it's kind of like an old-fashioned sexism that we think that childbirth should just be this thing that women have to do and labour over, and it's difficult, and that's life. When we have invented things like caesareans, epidurals.
Yeah, I don't think people realise that even in the Western world today, childbirth and pregnancy are the most dangerous thing a woman ever does.
Exactly.
And can I just say, it shocks me, just quickly, that the idea that a GP, a professional doctor giving birth, wasn't listened to. You know, if you weren't listened to in that experience, that incredibly sensitive moment, then what chance does a regular woman trying to express...
Or someone on here corrects you. At that point, I wasn't a doctor. Sorry.
Right. OK, folks.